Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to do a 3-part series on case selection for general dentists. This is my recommendation, what cases to take, what cases to not take, depending on your experience level. So we're going to start first with the green light cases. Green light cases means these are cases that any general dentist or pediatric dentist can take and should take. This is where I want you to get started. When you're first getting started, for your first 50 to 100 to 150 cases should be all green light cases. So let's go over the criteria. So class 1 cases, class 1 molar and canine. Check both your molars, check both your canines. If your patient is missing teeth, nope. I only want you to pick cases with all the teeth in from 7 to 7. That means from second molar to second molar, okay? And that's point 2. No missing or impacted teeth except for third molars, okay? That's it. And matter of fact, I'm not super thrilled if third molars are erupted. I'd actually rather than be out or impacted because it just complicates things. Like really impacted, not like partially impacted, like in the bone, high and dry, not in the way, okay? Class 1, so I don't even mean, you can't even be 2 millimeters class 2. Solid class 1 molar and canine, all four. All the bites on 4 different bites on all sides, all 8. Okay. No history, past or present, of periodontal disease. That means we don't have recession, we don't have furcations, we don't have, probing issues. Nice 2s and 3s on probing and no attachment loss. Okay, so you're getting the idea. This is a young patient. We're talking teens and 20s probably, okay? Most likely, could be 30s, not older patients. And I know this is harder because those of you who are general dentists, a lot of your practice is older. We're gonna get there. Those are gonna be more advanced. It just complicates things and it makes it less predictable. So I'm trying to have you stick with super simple cases. And I realize with these restrictions, it's gonna be a very small percentage. Now, it's okay if you're taking yellows, which is we're gonna get to, but you need to have an orthodontic consultant helping you with those yellows. These you can do on your own. It shouldn't be hard. Okay, next, in terms of, these should just be crowding and spacing cases only. Nothing weird, okay? Mild to moderate, less than 6 millimeters. You should know how to count that. It should be pretty darn obvious. That means it's not going to look that severe. These might be patients that usually have had ortho before and they relapsed. So most likely it's or they could be teenagers, just very, very simple teenagers. It's probably not going to be adults that didn't have ortho before, okay? So let's talk about the vertical. When they bite down in front, we want to see a certain percentage of their lower incisors. That's what we mean here. So we want to see at least 90% of their lower incisors, 80% of their lower incisors, 70, 60, 50, 40, 30. But if it's anything less than that, if I can't see the lower incisors at all, or if I only see a little bit, that's a no. If there's any type of anterior open bite at all on any of the front teeth, it's a no. Okay, you got to have some overlap on all 4 of the front teeth. That's what I'm talking about. So not a severe deep bite case and not even a tad of an open bite case. Pretty normal vertical, okay? No open bites. Also, no cross bites of any form. No posterior cross bites, no anterior cross bites, okay? Everything is perfect in terms of the interdigitation of the back teeth and no anterior cross bites, no open bites. You get the idea, okay? So this is your green light cases. Go for it. You can do these yourself. You can probably do these with any aligner brand out there or braces. Should be super easy. There shouldn't be any complications, assuming that you treatment plan it properly. All right. So do these cases. Thanks.